Reopening Singapore's borders in a safe and controlled way, two experts give us their take on when and how it can be done.
The tragic reality of having COVID is that your mild cough can be someone else's death knell.
British Prime Minister Boris Johnson imposes tighter restrictions on the public as cases surge.
Anwar Ibrahim claims he has enough support to form a new government in Malaysia, and the current one led by Muhyiddin Yassin has fallen.
Hello, welcome to The Big Story, coming to you live from the Straits Times newsroom. I'm Olivia Quay.
And I'm Haryanto Diman. Now you can subscribe to the Straits Times channel so you never have to miss a single episode. Now, an update on the COVID-19 situation here. 12 new cases were confirmed today.
Today's count included one community case, a work pass holder. There were also 4 imported cases who had been placed on stay-home notices upon their arrival in Singapore.
Now, in the last 3 months, we've seen Singapore gradually reopening its borders, but that increases the risk of infections creeping into the community.
That's right. So let's recap the different travel arrangements Singapore has with other countries. On our end, general travel to Brunei and New Zealand has been allowed from this month, but people here cannot travel to either country until restrictions are lifted over there. Singapore is allowing visitors from these 2 countries as well. They don't have to self-isolate for 14 days upon arrival if they had remained in the 2 countries for 14 straight days prior to their visit to Singapore.
We also have bilateral green lane arrangements with 5 countries: Japan, China, South Korea, Malaysia and Brunei.
And Singapore is in discussions with places including Indonesia, Thailand, Hong Kong and Australia.
Let's now bring in Professors Teo Yik Ying and Dale Fisher. Now, Prof. Teo is the Dean of the Swee Hock School of Public Health at the National University of Singapore.
And Professor Fisher is a senior infectious diseases expert at National University Hospital. So while Singapore's imported and community cases have remained low, we're seeing a resurgence in many other countries, currently in Europe in particular. So given this contrast, should we further relax our restrictions on outbound and inbound travel? Professor Teo, why don't you start us off?
Well, thanks again for having me. I think it's important to highlight that there is no uniform policy on travel, and we have to consider the different tiers of restriction based on which countries we're talking about. Generally, I can think about performing a risk assessment on the basis of 2 aspects. The first is really the degree of community spread in a country. That should be preferably low, provided, of course, local authorities are able to get a good sense on the present extent of community spread in the country and not be underreporting or outrightly missing any segments in the population. And of course, second is having the necessary public health measures to track, trace, test, isolate cases quickly. And I think based on this criteria, some countries will clearly fall into the category of not allowing any inbound travel. Whereas we would see some other countries falling into categories that may allow some degree of restricted travel, perhaps for essential business travel, and others actually will be classified as mass market tourism even. And at the end of the day, it's about the chance that the rules we have in place for a country, whether they are able to stop an infected person from slipping through. And for a country where the situation is well under control, we really can afford to be a bit more relaxed and have actually the chance of missing someone coming in to be infected to be very low chance. Whereas for a country where the outbreak is widespread, we want to minimize incoming traffic as widely as possible.
Right. Well, Professor Fisher, where do you stand on this issue? Do you think it's time that we relax our restrictions?
Yeah, as YY just mentioned, it's all countries are different, and your question spoke about Europe, and that's not really the benchmark we should be talking about. I think there was a nice article today from Clara on a sort of a traffic light system of red and orange and green, and there's plenty of potentially green countries around. There's some with no recent transmissions. Places like Thailand, Cambodia, Laos, even China, Taiwan. These are all, they haven't reported cases for many months in most cases. then there's others with quite good control. They know where their cases are. These are South Korea, Japan, Hong Kong, Malaysia. They've all had recent surges, but they've been able to bring their case numbers down just with some nuanced restrictions. The point is they've known where their cases are, and they've been able to contact trace effectively, do some selective changes, such as in nightclubs and coffee shops, and they've been able to bring their numbers down quite sharply. This is not what you see in many other places in the world, such as Philippines is still having problems, the Indian subcontinent, Indonesia, and as we mentioned, Europe and the US. So I think we need to look at different countries differently.
Right. Now, according to coronavirus analyst Thomas Puyo, fences are necessary to control the virus, and if they are enforced, they'll be effective. How does Singapore's fencing measures stack up against the standards that Mr. Puyo mentioned? Prof. Fisher, what do you think?
Singapore is, in my view, leading the way in the sort of nuancing of these border restrictions. I think it's wrong to just bring in blunt, everybody must have 14 days quarantine like that. There are significant social and economic costs. This is not a zero-sum game. Let's just make sure and not let anyone in. This is, I think, too simplistic. Border closures, and just like lockdowns, really, they're a moment when you've bought some time, you can get your systems in place. And as we've seen in most of the Asian countries, many that I've just mentioned, most of them have got control of their outbreaks. They know where their cases are. So I would like to see border controls not be used so bluntly, and have, as I mentioned, a sort of a green, orange and red system.
Right. Prof. Teo, what do you think about that? Are there any weak links in terms of, our fences?
Well, at the moment, actually, I think as what Dale has mentioned, Singapore has taken a very nuanced approach towards addressing importation risk. And of course, we have learned this the hard way, because back in March, we allow some of our returning travelers to spend the 14 days quarantine effectively, but at home. And that was what has resulted in some degree of community spread, which I would say that we are still trying to recover from it. So we are taking a cautious approach. And I think when we talk about the fences, it's very important to also talk about whether the country has that commitment to implement and to enforce some of these fences in a very sensible way. If we are requiring people to spend a 14 days period of quarantine, but they get to spend it at home, even if they're returning from some of the worst hit countries, we have to decide whether that is actually prudent. And of course, when Thomas talked about the fences, I think there is also a need to understand the context of some country setting, whether it is possible to have the same degree of fencing in every country, because there will be different ability to execute some of the fences that we talk about. Just even talking about quarantining people in the government dedicated facility. Singapore has managed to do that, but I don't think many other countries will have the ability to do so when they are faced with large number of people coming into the country all the time.
Right. Speaking of large numbers of people coming into the country, if our fences are gradually removed, does Singapore have the manpower and the resources to monitor incoming travelers? An example I'm thinking of is when, MICE events with more attendees will be allowed in Singapore soon. So, Prof. Fisher, what are your thoughts on this?
I must say that I'm not sure the term fence is the right way, unless you want to say there's a gate in the middle of the fence, because this is really about being selective. The risk is very, very low of even one person coming in. If you let thousands come in from New Zealand, even Thailand, Malaysia, China, the risk of even one or two people being positive is extremely low because of the situation in those countries. Now, of course, Singapore can deal with that. We have cases every day, and we deal with it. So these people would need to be explained the rules. That is, you will wear a mask, you avoid the We don't let more than 5 at a table. All these types of things. There's a level of behaviour, and of course, if you get sick, we'd expect you to come for a swab. You have to have the app on. All these types of things. There need to be a bit of training, but I think it'll be, as long as you're selecting the countries with control, and there's probably a dozen that are easy to think of there, then you could really improve the social situation for a lot of people and the economic situation for a lot of people. I must say, even if 1 or 2 people came in under these circumstances, they would probably be a dead-end case anyway. That is, if they're always wearing a mask and not mixing in large groups, that even if they were positive, they may not even spread disease. So this is the strength of Singapore's response at the moment. Of course, if we opened the gate for thousands of Europeans, then yes, we could get overwhelmed because of the situation at the other end. So again, you've got to tune this to the country that you're talking about.
Right, great points there, Prof. Fisher. Now, just to round up our discussion for today, let's focus on testing strategies. In what ways can our testing strategies be more robust when it comes to balancing safety but not hindering travellers from visiting Singapore? Prof. Teo, why don't we start with you first?
Thanks. And actually, I'll just follow on from what Dale has mentioned, because I don't think it's just about testing strategies, but more about the overall consideration that we place with respect to grouping countries in different tiers or different levels of risk. And for countries that are in the low risk groups, we may not need to be creative with testing strategies, because generally, as what Dale has mentioned, the risk of someone coming in with an infection could be exactly the same as the risk of us meeting an infected person in Singapore when you walk along the street, which is a very low risk presently. And there's often that perception that if we now move towards a process of testing everyone that is coming in, and maybe even test them repeatedly, we can hopefully shorten the length of quarantine. It's not that, because it all comes back to the risk assessment that we perform, that we classify countries on the risk of importations and to consider the overall body of public health measures around prevention and risk management, whether it is quarantine, whether it is deciding, is it 14 days quarantine, 7 days quarantine, whether you stay at home during that quarantine process, or whether it's a dedicated facility. So it is not just about being creative or robust with your testing strategy. I like to think that it comes back to the way that we perform our risk assessment to group countries in the different levels of risk. And then we start to put in place the strategies, whether it is quarantine, whether it is an observation, whether it is testing, based on that risk assessment.
Prof. Fisher, your thoughts on this?
Yeah, I thought for sure YY, as Dean of the School of Public Health, would have started talking sensitivity and predictive values. When you're testing a low-risk population, then there's a very good chance that even if you find a positive, it's going to be a false positive. So I would actually stand up and say that these very low-risk countries, I wouldn't even test them. The chances are minute, because they have hardly any cases in their own country, and if they come, it'll be a false positive, and the effort, the logistic exercise, the cost, the diversion from other activities in doing thousands of tests in extremely low risk people, I wouldn't support. Obviously, testing in, if you like, the orange and the red lanes, then obviously, but that'd still be linked to whatever period of quarantine you wanted. So again, just like who can come in and the length of the quarantine, I think that package needs to be linked to who needs a test.
Right. Prof. Teo, do you have anything that you might want to add?
Final word?
Yeah.
Right of reply.
Well, actually, Dale is exactly right, because I've just worked with our colleagues at the Straits Times to share a commentary article around sensitivity and predictive values, and I believe it should be coming out soon. So read your Straits Times and you would see what we have to say around that.
Well, thank you so much, Professor Fisher, as well as Professor Teo. And like what Professor Teo mentioned, the commentary by Prof. Teo is going to be coming out, so watch out for that as well. Now, great insights from the both of you, and a pleasure to speak with the both of you, of course. We were joined by Professor Teo Yik Ying, Dean of the Swee Hock School of Public Health at NUS, and Professor Dale Fisher, Senior Infectious Diseases Expert at NUH.
In other Singapore news, residents at Toh Guan Dormitory will be undertaking additional routine testing for COVID-19. This as part of a pilot program to understand the impact of more frequent testing on earlier detection of asymptomatic cases among migrant workers. So, over a period of 4 weeks from Friday, September 25th, the government will trial an additional round of testing on top of the existing 14-day rostered routine testing cycle.
From October 17th, if you want to visit any beach in Sentosa during peak periods, including weekends and public holidays, you'll have to make a booking first. The booking system will be trialled for an initial period of 3 months for Tanjong, Palawan and Siloso beaches. Visitors may pre-book their entry up to 7 days before their intended visits, subject to capacity limits. They may choose from 2 time slots, either the morning period from 8 a.m. to 1 p.m. or the afternoon from 2 p.m. to 7 p.m.
Meanwhile, only up to 500 visitors a day will be permitted on Kusu Island during the upcoming pilgrimage season. The island is home to a Chinese temple and 3 Malay shrines, and the annual pilgrimage attracts thousands of devotees who visit the Ta Po Kong temple. From October 17th to November 14th, each ferry to and from the island will carry no more than 50 passengers. Reservations are required and can be made from this coming Monday for a maximum of 5 people per application.
A policeman was sentenced to 2 years jail today after receiving sexual favours from 2 women who are the subjects of separate police investigations. Mahendran Selvaraju had pleaded guilty to 2 counts of corruption and 2 counts for offences under the Computer Misuse Act. For each count of corruption, an offender can be jailed for up to 5 years and fined up to $100,000.
The slide in Singapore's core consumer prices eased last month on smaller declines in the costs of services, retail and other goods, as well as electricity and gas. Core inflation came in at -0.3% in August, up from the decade low of -0.4% in July. It was the 7th straight month of core consumer prices falling below the same period a year ago. Meanwhile, overall inflation was unchanged at -0.4%.
Now, overseas, British Prime Minister Boris Johnson has announced a raft of new COVID-19 restriction, warning that Britain is at a perilous turning point. The new rules could last for 6 months.
In a major U-turn from his previous message, Mr. Johnson told office workers to now work from home where possible. Across the hospitality industry, all pubs, bars and restaurants will be restricted to table service only and must close at 10 p.m. Individuals may be fined £200 for not wearing a mask in places where masks are mandatory.
And to those who say we don't need this stuff and we should leave people to take their own risks, I say these risks are not our own. The tragic reality of having COVID is that your mild cough can be someone else's death knell.
To take this further, we're joined by foreign editor at the Straits Times, Bhagyashree Garekar. So Bhagya, as you know, Britain is seeing over 4,000 new cases each day, the same pace it was at the beginning of April. So for a bit of context first, how did the second wave come about in the country?
Firstly, you have the summer, which has ended, and now you have the autumn setting in. And in autumn, you have all these, seasonal viruses come in. So the fear is that with that, you have more cases. Certainly, I think the cases, like you mentioned, was 4,000 cases a day now. It's feared even to go up to 50,000 cases a day. Did people get a bit tired of the kind of restrictions that were being imposed, which were minimal actually, about maintaining basic hygiene, social distancing, And then there is the lockdown, which was released. Now, once you have the opening up of the economy underway, you are going to see a certain amount of, infections creeping up. There was summer travel. So, it's a combination of all these factors. They were kind of bracing for it, but, it's been very stark. And it's not just UK, it's other nations in Europe as well.
And what do you make of Mr. Johnson imposing the restrictions for 6 months? And what are the implications for Britain's economy?
6 months would actually cover the winter, autumn and winter, right? So possibly it's one factor possibly is that. And if you heard Mr. Johnson yesterday, he did say this is not it, meaning it could be worse. He could impose further restrictions. And the foreign minister as well, I think today he said a second full national lockdown can't be ruled out as well. So 6 months possibly is a safe thing, and I think they're fearing even 50,000 cases a day, so it's a reflection of that. Implications on the economy. It's a difficult challenge for a government anywhere. You are balancing these restrictions for health reasons, for saving lives, and you have livelihoods to take care of. Already, British economy, like economies elsewhere, has been showing a weak rate of growth, and that's going to continue. I think the estimates that one saw showed about 6% or even 15% lower than, the economic growth lower than it would have been before COVID. So certainly the impact of on economy is going to be there.
What are critics saying about how the government is handling the crisis?
Well, the critics are critical of a couple of things. First, that Britain isn't testing enough, isn't tracing as well enough. So I think their testing aim was to go up to 500,000 tests, but they require something like 1 million. This is going to happen by the end of October. So they're clearly short on that front. And the tracing mechanism apparently isn't as good either. But looking just at the reaction to the restrictions that Johnson announced yesterday, I think some polls showed that up to 70% of people in UK are supportive of the measures. And I think 45% of them think it could even go further. I think 10% or so say that they've been too strict.
Well, thank you so much for coming on to the show, Bhagya. We've been speaking to the Straits Times foreign editor, Bhagyashree Garekar. Now head over to straitstimes.com for COVID-19 updates around the world.
So here are some global headlines for you. In the US, flags were placed in front of the Washington Monument in remembrance of more than 200 lives lost due to COVID-19. Experts warn that with schools reopening and more gatherings taking place indoors as the weather turns colder, there could be a further spike in cases on the way. According to Johns Hopkins University, nearly 7 million people in the US have contracted the virus.
Cases are surging in Indonesia. On Tuesday, the country's coronavirus death toll increased by 160, the most in a single day. And the total number of new cases rose again by more than 4,000. In Jakarta, hospitals are running out of beds and waiting lists are growing by the day.
The death toll from a residential building collapse in India's Bidwandi city rose to 35 as rescue operations continued 52 hours after the tragedy. The casualties included 12 children, while 25 people with multiple injuries were admitted to hospital. The three-story building had collapsed early on Monday when the residents were asleep. The police have booked the building owner for culpable homicide, claiming neither did he take efforts to repair the building's broken pillar, nor did he convince people to vacate the building.
Across the causeway, Malaysian politician Anwar Ibrahim said today that he has a strong, convincing, formidable majority to form a new government and that the government of Prime Minister Muhyiddin Yassin has collapsed. Mr. Anwar added that the MPs with him now include those from the ruling Perikatan Nasional Alliance. He declined to give the exact number of MPs on his side and would only reveal it after meeting the Malaysian king. Prior to this, the three-party Pakatan Harapan coalition that Mr. Anwar leads has 91 MPs.
Well, those are our top stories for today. For more news and videos, visit straitstimes.com and subscribe to our YouTube channel by hitting the red button below.
Once again, I'm Haryanto Diman with Olivia Quay. Join us tomorrow for more stories on A Big Story.